Our next presentation is Anti-VEGF Treatment Can Diminish Signs of Diabetic Retinopathy Without Reducing Non-Perfusion by Dr. Ramin Tadayani.
Thank you very much. These are my disclosure. Here is the question. Anti-VEGF can improve DRSS on color photos, and this has been shown several times, including the study you hear. But they don't eliminate the risk of neovascularization shortly after discontinuation, and this has been also showed. So we know that DRSS is valid for assessment of non-perfusion changes in untreated eyes, but we have never established that it's valid after injection. So we had a question, it was, can anti-VEGF improve DRSS without reducing non-perfusion that create the novocelles and the problems? So we looked at this in two different ways, published in two papers. First, we looked in FA, and then we confirmed in OCTA, so I'm going to present here the results. Basically, the two studies are very similar. A case series of patients, treatment naive, severe NPDR and PDR. They were treated for DME, and we looked to the images before the injection and 1 month after just 3 injections. For the FA, we use ultra-wild field OCTA, the Optus, and for the OCTA, we use the Plexelit by Zeiss with montage of wild field OCTA. So the OCTA cover an area which is smaller than ultra-wild field, but still larger than ETDRS areas. We really try to have a haute couture image analysis and try to crop the images to their common part, really to align them, divide into boxes to be concentrated in each box, and try to eliminate any artifact and bias we were aware of and has been published to be sure of the result that we are presenting here. One of the points is that we also find that the DRSS and the color photos improve very quickly. Just after the 3 injection, you have a cleaning of the fundus that looks much better and reassuring. But when you look to the non-perfusion, by ultraviolet field FA, but also by OCTA, we didn't find any changes and no improvement in these eyes. To illustrate that, this is a case of proliferative diabetic retinopathy. So you see the novocelles here before, so in the first line with FA, in the second line with OCTA, before and after injections. So the novocell disappears, so that's better, and anti-VEGF should act on novocell. That's their job. But when you look to the non-perfusion areas, actually they didn't change at all. You'll find the same non-perfusion areas in both of them. Even more, if we look to small vessels perfusion on OCTA, like in FA, in more than 2/3 of the cases, some small arterial venules are no longer detectable after 3 injections. So they just disappear, and here in the yellow arrows, you can see some of them that were visible before and they are not after. We don't know if they are related to the injection or it's just a disease that is progressing. Interestingly, in the second study, patients have ultraviolet field FA, and they have also OCTA, wild field OCTA. So we were able to compare to see what's the value of these exams. And it appears that OCTA shows much easier and much more non-perfusion areas than FA. For example, you have an example in the FA that you don't see any non-perfusion, but on the OCTA is easy to know. Concerning the change, because many of the change of perfusion in FA are based of the gray level changes. So here you can see a case before and after injection. And for example, you can see to these 2 areas that seems to decrease in size, but we think that this is related to an artifact because there is less leakage and the image processing is different. And that's exactly what OCTA showed. In all these cases that we had some improvement in these gray areas, actually there was no reperfusion confirmed by OCTA. So here are our conclusion. So 3 anti-VEGF injections can control neovascularization, and DRSS score, of course, improve on the color photos. But we didn't find any reperfusion on FA or OCTA that is significant. So we can answer our question, which was, can anti-VEGF improve DRSS without improving the non-perfusion? Yes, that's possible, and we had plenty of examples here. In practice, that means that in a short term, at least, when we do just a few injections, here we just did 3 injections. I'm not talking about many injections, that I don't know. But after a few injections, when there is an improvement in the fundus, it should not be considered reassuring. If a patient looks like a severe NPDR and after a few injections looks like a mild, actually the risk is probably hasn't changed. For future studies on diabetic retinopathy, we should know that after intravitreal injection, the color photos may not be valid to evaluate the diabetic retinopathy, and especially if you go to NPDR trial. So, and FA also can change with images that are mainly biased. So it's important, we think, right now, if there is any trial on this, to use a multimodal assessment until we learn more how we can assess diabetic retinopathy once the injections are done. To finish, I want to acknowledge my colleagues, Sophie Bonin, Aude Couturier, Léa Benedict Dupin, Alain Godric, who contributed a lot to this work. And also, if you want more details on these papers, you have the references here. Thank you very much.
Thank you.